We want this to connect to Oklahoma. We want it to reflect a timeless picture of Oklahoma, and for every Oklahoman to walk in and be proud of what represents healthcare in their state.
The discussion about the patient tower goes back over 10 years.
A lot of the inspiration was taken from the geology around the area.
Look at the landscape, look at Oklahoma, and find something that's timeless. And that is really what inspired what historically was going to be a box.
Healthcare facilities don't seem like they've evolved for a long time. We wanted to try to get beyond this sort of almost a warehouse of medicine.
One day we walked into our room and they had a picture up of Gloss Mountain.
We're attracted to Glass Mountain for a few reasons. Number one, it goes vertical and has a certain mounding and scaling.
And as you look at the building itself, there's a lot of horizontal striations and horizontal paths and lines of sight.
What I really liked was its profile along the skyline. You know, the idea that it has a silhouette and a form, and the way the sky connects to the ground. Through form and through proper, again, scaling, you can produce something that feels very humanizing.
Art and architecture are a big part of the healing process for our patients, but also for our caregivers.
It helps with the healing process to have this environment where you as a patient feel that this whole health system, everything about it, the buildings, the people, the equipment, we're thinking about how we can serve the patient better.
When you walk in, then you're going to see that represented in the colors chosen, as well as the artwork that is supposed to capture either the sunrise, the sunsets, the wheat fields, the landscape that you see across different portions of Oklahoma.
When you look at where it's located, it has an opportunity to be a front door for the entire campus.
And truly captures the spirit and the resilience and the compassion and the pride that all of us have in Oklahoma.